He was seen as a liberal, partly because he came off the back of a more conservative Pope Benedict XVI. But he is actually quite traditional and quite conservative on social issues. And bear in mind, he said these words in the context of an interview rather than a sort of formal speech. There's not been any sign of high-level discussions at the top echelons of the Catholic Church. So I wouldn't expect the Catholic Church to change teaching on this core policy imminently.
Mark Lowen in Rome. Nigeria's security forces are being widely condemned for killing at least 12 protesters in Lagos yesterday. That this even happened has only today been confirmed by Amnesty International. Authorities have imposed an indefinite round-the-clock curfew on the city and elsewhere, but some are defying the order. These are demonstrators demanding changes in the way the security forces are run and wider government reform in Nigeria. Amnesty says most of the victims died when soldiers opened fire in the suburb of Lekki. The Nigerian army has denied involvement. There have been international calls for calm, as Anne Soy reports.
The UN Secretary-General Antonio Guterres has urged the Nigerian security forces to exercise restraint and said the perpetrators of the killings should be held to account. And perhaps unsurprisingly, the violence in Lagos has struck a chord in the United States, where similar protests against police brutality took place earlier this year. The Democrat presidential candidate Joe Biden, in a statement, urged Nigeria's forces to cease the violent crackdown on protests.
The BBC's Anne Soy. The first of 8 planned repatriation flights for Australians stranded overseas will leave London later today. Those classed as vulnerable have been given priority on the flight, chartered by the Australian government and operated by Qantas. It's a direct service to Darwin, where all passengers will have to spend 2 weeks in quarantine at a facility in Howard Springs. The ABC's Barbara Miller has more.
It's a race against time for Stephanie Louise Nitschke.
I didn't get to book onto the flight till yesterday. And now that meant driving from Aberdeen overnight to Birmingham to get a COVID test. And then now I'm driving from Birmingham to drop off my COVID test in Cambridge and then driving to London.
The 31-year-old Victorian, who's been teaching at a primary school in Scotland, is on a charter to repatriate some of the Australians stranded overseas. Oh, wow.
It's been quite a journey.
And why do you have to drop the test in Cambridge?
So they said the only way to make sure that your results would be there on time is if you drive the test yourself to our lab so that they can get those results for you in time so you can get on the flight. But it's still, a chance that it doesn't get through on time and I can't get on the flight after packing up my whole life and driving overnight and that all within a couple of hours, really.
Those classified as vulnerable are being given priority for tickets, which cost $2,150. Stephanie Louise Nitschke is due to give birth in April, and after having a series of commercial flights cancelled, had started to think she might not make it home in time.
I've been pretty nauseous, I've been pretty sick, and hence sort of why I've sort of really felt like I was more keen to get back home. Not having that same support network here has been difficult. So I'm hoping that I'm not sick on the flight, but we'll see.
The direct flight from Heathrow will take close to 17 hours, touching down in Darwin around midday on Friday. Sunshine Coast woman Rachel Murray and her daughter and son-in-law are also on board.
It's been such an awful time over here with the virus. So I approached the DFAT and said that our mental health was very poor, myself and my daughter. And they classed us as vulnerable people, which we are. And they expedited us to come back. I'm so grateful.
Rachel Murray is taking no chances on her way to the airport.
We bought visors as well. So in the taxi, we're going to be wearing masks, visors and our gloves as well, our plastic gloves.
The new arrivals will have to spend 2 weeks in quarantine at the Howard Springs facility before they can finally return home. And what are you looking forward to once you get out of the Howard Springs quarantine?
Oh, God, hugging my son, being able to walk around without a mask. I don't have to be scared of catching the virus all the time.
2 more flights from the UK, 4 from India and 1 from South Africa are planned over the coming weeks. In total, around 1,300 Australians are expected to be repatriated on the flights announced so far, just a fraction of the 32,000 who've registered as wanting to come home.
I know there's lots of people who are in the same situation at the moment, and even though I feel like things have been hard, I know it's really indicative of what everybody's going through. So I think it's important to share it and have people listen. So I appreciate it. Thank you.
That report by the ABC's Barbara Miller. Meanwhile, Australian farmers and tourism operators have written to the federal government pleading for backpackers to be allowed into Australia. The Australian government is trying to pinpoint labour shortages this summer. The current estimate is that there will be a shortfall of more than 20,000 working holidaymakers. To America now, and a record-shattering number of voters have already made their voices heard in the presidential election. Almost 40 million ballots have so far been cast. That's 200% more than at the same stage 4 years ago. But there have been concerns about voter intimidation, as CNN's Pamela Brown reports.
With the election less than 2 weeks away, voter intimidation is coming to the forefront. Election officials in Florida and Alaska went to the FBI after dozens of people reported receiving emails threatening to vote for Trump or else.
I think calling it out and letting it be seen for what it is will hopefully encourage people to ignore it.
The email was made to look like it came from a far-right group, the Proud Boys, but they have denied involvement. And a CNN analysis found the emails were actually sent in a sophisticated way, routed through foreign servers. More cries of possible voter intimidation in Miami. A police officer in full uniform wearing a Trump mask inside a polling place called out by the mayor.
His actions have violated departmental policy and he will be disciplined.
And in Memphis, a poll worker was fired for asking voters to turn their Black Lives Matter shirts inside out.
This particular incident was the bad behavior of one poll worker.
Tennessee laws ban any clothing worn to polling places that endorses a political candidate or party. Social justice messages like BLM are allowed. But overall, early voting remains in high gear. More than 39 million ballots have been cast nationwide so far. Over 1 million people have already voted in the battleground states of Wisconsin and Ohio, and staggering numbers in Texas, where more than 5.3 million have cast ballots, representing more than 31% of registered voters.
I just like to vote in person. I just know it's going to be there and I can guarantee it.
It's clear many Americans have been relying on the post office to deliver their votes. But as Election Day approaches, Michigan's Secretary of State is encouraging voters to turn ballots in personally to drop boxes or their county clerk's office if they can.
There are a lot of uncertainties and variables with the Postal Service.
A new Post Office Inspector General report finds the Post Office never investigated controversial cuts to service in the summer would affect mail delivery.
My office used the CARES Act funding from the federal government to install close to over 1,000 drop boxes all around the state for that very reason.
The Postmaster General, who has defended the cuts as non-political, postponed the changes. But on-time mail delivery is still suffering.
That report by CNN's Pamela Brown. And finally, it's being described as one of the biggest attacks on art and antiquities in post-war German history. But the mere fact that it happened has taken more than 2 weeks to emerge. At least 70 artefacts were sprayed with an oily liquid on Berlin's Museum Island, a UNESCO World Heritage Site that's home to 5 famous museums. The attack took place on October the 3rd, that's the anniversary of German reunification. Local reports are speculating whether supporters of a far-right conspiracy theorist may have been involved. This is Attila Hildmann, a well-known chef who has spread conspiracy theories about the pandemic and has also claimed that the island is home to the throne of Satan. And that's World Watch for today. I'm Max Toll. Mani?
Kia ora, Max. En koina te purongo o te paututanga mo tēnei rā ruatakau marua o whiringa Anōku, Thursday, October the 22nd. Stay with us for today's COVID-19 update from the Director General of Health with Ashley Bloomfield shortly. Kei te hoki mai mātou a pōpō and from the Midday team. Kia pai tō koutou rā. Noho ora mai.
RNZ News at 1 o'clock. Good afternoon, ko Kainwin Curtis tēnei. We'll be crossing to the Ministry of Health media conference as soon as it starts. In the meantime, here's the news. People have been arriving in a steady stream of cars at a pop-up COVID testing centre at Wainoni Park in Auckland's Greenhithe. It's one of 2 new community testing centres to open on the North Shore after someone who later tested positive visited a pub in Greenhithe. Everyone who was at the Malt between 7:30 and 10 o'clock on Friday night is being told to get tested and self-isolate. Another testing centre is open at North Care Accident and Medical in Rosedale. Greenhithe locals are taking extra precautions after hearing someone with COVID-19 visited the local pub. Patrons at the Malt on Friday evening have been told to get a test and self-isolate. Rob, who's lived in Greenhithe all his life, says it's a tight-knit community. He hopes people will be following the health advice and doing the right thing. He says some measures such as physical distancing are still in place at his work and he will consider wearing a mask again.
You know, I saw the news this morning and heard about it for the first time. So, yeah, I mean, we at work are sort of quite spaced out anyhow, you know, like from the second lockdown.
Greenhithe resident Rob. The police officer who decided not to arrest a drink driver with knives in his car the night before he murdered Christchurch woman Nicole Tuxford has been cleared of wrongdoing. When Paul Tainui was stopped at a drink drive checkpoint on April the 6th, 2018, he was found to be over the limit. A check of the police database showed he was a convicted murderer and was out on life parole. He was processed for drink driving and before leaving on foot volunteered he had knives in the car. The Independent Police Conduct Authority has found it was reasonable not to arrest or detain him, saying the officer believed Tainui's explanation for having the knives was reasonable. The registration of New Plymouth nurse Debbie
Well, kia ora koutou katoa. Welcome again to our update for today. So there are 2 new cases of COVID-19 to report today. Both are imported cases in managed isolation facilities. The first of these cases arrived on the 19th of October from the Netherlands via Dubai, and the second arrived on the 21st of October from Doha. They were both tested on arrival as they had developed symptoms during the flight. They are both now in the Auckland quarantine facility and in fact would have been taken there from the flight. Our total number of active cases is 58 and our total number of cases overall, confirmed cases, is 1,558, which we will report of course to the WHO. Yesterday our labs processed 7,083 tests and our grand total now is 1,047,994. An update on Christchurch. So the number of cases in the managed isolation facility at the Sedema Hotel is the same and it remains at 18. And all those in that hotel, the fishermen who have come across and arrived last Friday, are being retested today, day 6 testing, which is an additional test as part of that group. And we're expecting to have the genome sequencing back on the tests that have already returned positive. We will have that back late on Saturday. It's being done at ESR. Shifting then to Auckland, last night, as you're aware, we issued an alert through the NZ COVID Tracer app at about 7 o'clock last night to people who had been at the Malt pub in Greenhithe last Friday night. This was because one of the cases we reported yesterday, who was a workplace contact of the port worker that we reported over the weekend, had visited that pub between 7:30 and 10 p.m. last Friday. So I also just want to take a moment to thank the media as well for your support in getting that message out to the public last evening and this morning. So anyone who was in the pub on Friday night and their household contacts, I want to emphasise that, and their household contacts who are potentially contacts of possible contacts, they should self-isolate and get a test for COVID-19. And this is important, please remain in isolation till you receive your results. Now, I'm very conscious people don't want to be sitting around over the long weekend waiting for their result, so we have put in place a process to make sure that people are notified immediately that their result has been processed and reported back as quickly as possible. So the Auckland DHBs have also opened up 2 additional community testing centres on the North Shore, a pop-up centre today at North Wainoni Park in Greenhithe, and a surge centre is also open for a week from today at North Care Accident and Medical, which is off Constellation Drive. The Greenhithe pop-up had 25 people through in the first hour today, and it's great to see people getting out there in the community supporting our efforts to contain the virus. We hope there won't be any wait times, and remember, you can also get a test at your GP anywhere across Auckland, and that other centre at North Care is also available. So there are, in addition to GPs and urgent care sites, we also have the 6 permanent community testing centres, and 3 of these will remain open right through the long weekend. Those are the Northcote Community Testing Centre, North Care Accident and Medical, and the Whānau Ora Community Clinic in Wiri. There is also a number of urgent care centres across Auckland that are open also over the weekend for swabbing as part of their usual provision of after-hours care. If you want to know where the nearest place is to be swabbed, whether you are at home or indeed you are off travelling around somewhere over the weekend, then Healthline will be able to point you in the right direction. And an important reminder, a COVID-19 test is free of charge wherever you have it. So the pub on Friday night is what we would call an exposure event, and the people who were there have potentially been in contact with COVID-19 by being in the same place at the same time as someone who was infected with the virus but was not aware and may have been contagious. We go back that 48-hour period prior to their developing symptoms. It's another example of the value and importance of people keeping track of where they have been, and anyone who scanned in with the NZ COVID Tracer app on Friday night will have received that push notification. So please keep the app with you and use it. And getting in touch with people quickly who may have been exposed is extremely important. Time is our friend in this case, and also potentially our enemy. We would rather keep it on side. In addition, a family member of a person who tested positive, that is one of the 2 cases we reported yesterday, also attended Rangitoto College briefly after returning a negative test, so had been tested as a contact of a contact, tested negative, attended the college briefly, and then went home and is subsequently in isolation. And the Auckland Regional Public Health Service has assessed the risk to the school community as being low. Just to reiterate, the student had returned a negative test already, and indeed had very little exposure to the family member who subsequently returned the positive test over the 2 days prior to that person becoming symptomatic. So there is information that's gone out to the college and will be passed on to the college community just as part of our reassurance today. Just generally, if you are contacted by public health staff, either in Auckland or anywhere in the country, and asked to be tested because you are a possible contact, please do that promptly and remain in isolation until you have that result. And then even if the result is negative, because you may have had contact, please monitor your health carefully for the full 2 weeks, which is the period within which you may, if you are infected, develop symptoms. And I think if people could please also consider ways over that 14-day period to minimise their social exposure to others, and be diligent, of course, about using the app to record where you've been. Anyone who is a close contact is required to self-isolate for the full 14-day period, and they're tested twice during that period and have daily health checks. But those additional precautions that we're targeting here, it will just help us limit any potential for the virus to spread. Now, we're about to head into a long weekend, and that will, I know, provide a well-earned break for many people. Remember, though, this virus does not take breaks. So wherever you go, whatever you're doing over Labour weekend, in order to help us all enjoy it, please, let's all do a few things. First of all, record where you have been. If you see a QR code, scan it. Well, a QR code in a place you're going to go into is appropriate. Scan it. This is particularly important as many people will be moving around the motu, and you may not later recall the places and where you have been while you're away from home. Even if you've fallen out of the habit of using the app, and we're down to around 500,000 scans a day, whereas we were up at several million a day a few weeks ago under alert level 3 and 2 in Auckland, please get back into the habit. It's a small thing you can do that can have a huge benefit. And to businesses, please ensure your QR codes are visible. You are required to display them, and please encourage those people accessing your businesses to scan it. And I particularly encourage hospitality venues to do that, because those are venues where people tend to be crowded, in close contact, and where it's much less likely to have a record of all the people who were there otherwise. In addition to using the app, those behaviours that we have now all internalised, I'm sure, washing hands regularly, think about physical distancing, and of course good cough and sneeze etiquette. I'm also strongly encouraging people, as I am doing, to still use a mask on public transport and on flights. I know of people who have gone on flights with the intention of using a mask but felt embarrassed because they were likely to be the only person to do so on the flight. Please, we've all got masks. We were using them, all of us, during alert levels 3 and 2. Dust them back off, and when you travel over the next few days, please do use your masks on public transport or on flights. And most importantly, if you are sick, stay home and get a test for COVID-19. If you become unwell while visiting somewhere else away from home this weekend, please call Healthline. They will be able to give you advice, including on where you can get a test. Testing will be available throughout the country over the long weekend. And finally, a quick note on Dunedin about a case that we have had under investigation who is on board a ship off Port Chalmers. A person on board this ship had a couple of days ago returned a weak positive result, and we have since confirmed that not only is this an historical case, that it has previously been reported in India some time ago in August, so they are not considered a case for New Zealand reporting purposes. The person is not considered to be infectious, so presents no risk, and all other crew on the ship returned a negative test. I'm open for questions.
On Labour weekend, considering the Malt case, do you have any specific advice for Aucklanders travelling out of town, or perhaps those having Aucklanders come to stay with them?
So the advice is what I've given, and it's for all New Zealanders, and I think Aucklanders will be particularly aware of this, and that is take the precautions that we can all take, and those few actions, including using the app to record where you've been. If you are flying or taking public transport, use a mask is my strong advice, and of course, if you become unwell or are unwell, don't go on holiday if you're, and get a test instead.
Any advice around gatherings?
Around gatherings, no particular advice on gatherings. The most important advice on gatherings is if you are intending to visit, to attend a gathering and you're unwell, don't attend.
How are you feeling about that? How are you feeling?
Go here, yes.
Dr. Bloomfield, the person who went to the pub, the port worker, can you clarify where authorities think that person was infected now? I mean, how likely is it that person was infectious on Friday if they were only exposed on Friday? Or are we now thinking they could have picked up an infection sometime earlier?
Yes, I'd just like to make a couple of comments there. First of all, this person developed symptoms Sunday night, so Friday night was right at the beginning of the period when they may have been infectious. Secondly, and there's been some discussion about this in the media today, is the question of whether that brief exposure to our initial case that was symptomatic on Friday morning and was the first case we reported on Sunday, whether that brief exposure of only a few minutes was the point where that person got infected. It's possible, but what we are also exploring is that both our other two cases, including one of the ones that was reported yesterday, had worked on the same ship on the 12th of October, so they may both have been exposed at the same time.
Is that the Safrana Seville?
That's the Safrana Seville. So yesterday we reported two cases. One was the person who shared an office with our original case and had also worked on the Safrana Seville and had gone into the quarantine facility in Auckland on Sunday as a precaution, as a close contact, and because they had worked on the ship. So the possibility is that the infection of this third person could have been from either of them, and that is of course what we are now working closely with the Public Health Unit to establish.
How are you feeling about the fact that the amount of people using the COVID Tracer app has dropped significantly, like you said? Does it worry you at all?
I'm feeling we could do a lot better, and it's in all our interests to do better, and so again I would just encourage everybody to use that app. We've done it before. I'm very encouraged by the proportion of Kiwis that have downloaded the app. And because of that, we have up-to-date contact details on many people, and we are able to push notify. But the value of the push notification is only there if people have scanned in, so please do.
And how ready should we be to move to an alert level, even if it's just to 1.5?
There's no alert level 1.5. I can categorically say that. There is an alert level 2. Obviously, the government is interested in knowing whether there are any indications whether we should move up alert level 2. At this point in time, we're not advising that, but of course we will be reviewing that on a daily basis. What I would say, of course, is if we do these other things, including the things I've asked everybody to do over this long weekend, that is how we will avoid going into alert level 2 or up further alert levels, particularly with this long weekend coming. And I think this is a good opportunity for us to reflect on the fact we would all like a good summer holiday over Christmas and New Year, and if we can embed these behaviours, we are much more likely to be able to do that.
And what is the threshold to move to an alert level? Is it if there is a positive case found connected to this pub up in Auckland?
Well, if you look at alert level 1, that we're still in what I would call a very contained situation under alert level 1. So it would be if we started to see additional cases, and particularly ones that we couldn't immediately link to the cases we know about, that's when we would start to think about whether we needed to move up alert levels. But there are things we can and should be doing before we move up alert levels. Please, just.
Any results from this foreigner survey yet?
No, we haven't, and we're expecting those later today from Australia, from Brisbane, and I know there's a lot of interest, so we will make that information available with an update once we have it. Well, we've been able to identify all the people who had the app and send them a push notification. We are relying on others to identify themselves if they were there that evening, and the message that went out last night through the media, again, thank you, will I'm sure have let people know, and we're already seeing a good response in the number of people who are going for testing. So.
Some people I heard the owner saying had written down details. Have you called all of them?
We would have been provided with those details, and I'm confident they would have all been phoned and hopefully spoken with this morning. Sorry, what I'm going to do is go to the other side, just while
I was just wondering, how often are serology tests happening, and are they being done on all new positive cases or just weak positives?
So we're using serology where there's a question about whether the infection is acute, or what our sense is that it is an historical infection, to help us confirm that. So where they've got a high CT or cycle threshold value and they're asymptomatic and may even have a history of perhaps being exposed to or having had the virus in the past, whether here in New Zealand earlier in the year or offshore. So then we will do serology, and that's part of also what is happening with the testing in Brisbane of the crew on the Sovrana Seville.
Why not err on the side of caution here and ask all casual contacts to self-isolate for the full 14 days and return to tests?
The risk to casual contacts is a lot lower than it is for close contacts. So that's the first point. The second is because we're now day 6 and 7 after that possible exposure to an infectious person, that's right at the peak point where the vast majority of people would be, if they have become infected, would be showing up that infection. So what we are asking them to do is get tested, wait till they have the result before they, and stay at home until they have done that, and then for the balance of the 14 days be alert to symptoms and also to limit their exposure to other people. So that's, we feel, is an appropriate and reasonable balance.
Is the Ministry checking whether anyone from Malt on Friday night also went to the All Blacks game as well?
We haven't done that as yet, so I can't tell you any information on that. But what I would say is that even if they were exposed on Friday night, remember that it was just 2 days then till the All Black game, and so that would be a very, very short period within which they may have become infectious. But obviously that's something in our minds, and if people become a case, then of course that's something that would be followed up. But I think also this reinforces the importance of everybody, whether they were at that game or at the game here in Wellington a week before, or whatever they've been doing. We can all take those precautions, because you don't know if the person sitting next to you is the person who might have been exposed and they're sitting next to you on a flight or on the bus. Please.
Can I ask you about back to the pub briefly.
Yes.
Do you know how many people were in the pub that night and how many registered with the QR code and how many manually wrote it down and how many have been traced?
I don't have those numbers off the top of my head. What I can say is that this is not a pub that's in the centre of Queen Street where people are coming and going in different establishments. I understand you have to make an effort to get there in the sense that it's accessible by car or taxi or Uber, and that people tend to go from there. It was packed, but it's not a huge establishment, is my understanding.
So you can't say how many have been traced so far?
No, but we'll provide an update on the number, first of all, that we were able to send the push notification out to, and then the number that may have recorded their details there, if there were people that did so, and also an update on the number of people who have been tested who are volunteering that they were there. Right to the back.
Thank you. Should border-facing workers live in a level 2 or level 3 bubble? Especially now that we've moved to hosting on a fairly regular basis these large-scale events?
That's not something we've considered, and it has been raised before. However, the measures that we put in place for our border workforces, wherever they are working, are designed to ensure that, given that they are exposing themselves to risk, that they can lead as normal a life as possible. Hence, the use of PPE, reducing exposure, regular testing, and we've seen in this instance that has helped us identify a case very quickly.
And when talking about level 1.5 earlier, you had a little smile because in the past you've mentioned something like that, just some kind of level where people keep using the masks, keep washing their hands, just a greater sense of awareness. It doesn't exist, but would you like it to exist, especially for cases like this?
Well, rather than it being a 1.5, I tend to think about a 1+. So we're in alert level 1. Alert level 1 is what it is, but we can add some things to that. And one of the things I'm strongly suggesting people add is using masks, even if it's not compulsory. And we've done it before, and how quickly everyone took that up. And it's amazing how quickly we've stopped using them. Now's the time, I would say, to add them back in. So final question at the back. Sorry?
So are you saying, in your mind, we should be in level 1+ now?
Well, we're in level 1, and again, nice phrase, level 1 is not level none. And when one of the reasons we want to be flexible and responsive by adding some things into level 1 is to avoid going to level 2. And so we've made some suggestions about the things that people should routinely be adding to their current level 1 practices.
Wouldn't level 1+ effectively be level 1.5? It's just semantics.
Well, it's just the 1.5 sounds very exact, doesn't it? And it sounds like a new level. What I think that the alert level framework has served us very well, and it's very clear about what it does involve and what the triggers are to move up or down alert levels. But it doesn't mean we can't be flexible within those alert levels, and that's what I'm suggesting. And this is really just paying attention to things that we can and should be doing anyway.
And just on the app, from your health perspective, would it make sense to make QR codes compulsory?
So at the moment, it's compulsory for businesses to display them, and we are looking at options for how we could require people to use them. But my sense is, from what we've seen to date this year, and particularly during the Auckland August outbreak, if people understand the imperative, then they will use them anyway, even if it's not compulsory per se.
Just quickly following on that, do you think that requiring people to use them will better support the response?
I think they're an important element of our response anyway. The other thing I'm interested in, and we are doing work on it, of course, is continuing to add functionality to the app. And one of the things that is likely to be of most value in an alert level 1 situation, as we are now, is the addition of a Bluetooth proximity functionality, and that then will be less clumsy perhaps than the requirement, if we can get it right, than the requirement to scan the QR codes. In the meantime, I'm encouraging people to do so, please.
When will you decide if the next flight of fishermen from Moscow will be delayed?
So that's a decision that sits with MPI and with MB, who the latter being the group that oversees the facility. One of the things that will be a determinant of when that flight arrives will be whether we need to keep the current group that is in that facility, because it's the same facility that's going to be used, whether we need to keep them for longer than 14 days. Our thinking is at the moment that it's likely we will need to keep them for at least an extra 3 days, so that will necessarily delay that flight. Follow-up question?
The 6-day testing,
yes.
Is that going to now be compulsory? Have you made a decision for all foreign workers coming in?
Not necessarily. We've added it in this time because we had a situation where we got quite a large number of tests in that first day 3 testing, and we've got that situation where there are people in twin rooms as well. Now, those who have tested positive have been separated out, but we wanted an opportunity to do another sweep and just see had there been any potential cross-infection either inside the MIF facility or on the flight that hadn't been picked up at that day 3 test, and then that provides us with an opportunity to sort of reset things.
Is there any way that we can ensure the testing in Moscow is rigorous enough, or no, because it's not our people there?
So, two comments on that. First of all, even where that testing is rigorous, and everything we have suggests that it was effectively the gold standard, it was nasopharyngeal swabbing, it was PCR testing, and it identified 2 people as positive cases who didn't board. What it doesn't account for, it doesn't always find the people who may be incubating the virus, who then get on the plane, potentially infect others there, and or potentially become positive inside the managed isolation facility. So we treat everybody the same, regardless of whether they've had that pre-departure testing or not.
What measures are in place to ensure that dozens of staff coming and going from the Sedema aren't coming back, aren't going to pick this virus up and potentially spread it into the community? Are there any additional measures being put in place at the moment?
So the measures we have in any managed isolation facility, and for those working in the quarantine wing, again the same very strict measures because they're working with people who are known to be positive for the virus. However, in addition, in this instance, we've added in an extra test for those staff, which will be done early next week for all staff who have been working with those current guests in the facility.
And are men still double bunking?
There are still, most of them are still in twin rooms, yes. And we yesterday our teams from here, from MB and the Public Health Unit got together to look at the risks and benefits of potentially separating people out, and felt on balance the risks were higher moving people around, given that the situation is well contained now and we're doing the extra testing today.
So will the men continue to double bunk until they finish their isolation period?
Yes, and of course there will be the further testing at day 12 and then probably the extension of it. But at the moment we're confident in the arrangements that are in place, but of course we're always prepared to review that if something happens.
So you would be happy to implement again?
Sorry?
With another intake, you would double bunk again? You wouldn't change?
Well, I mean, that's not my decision per se, but in this case that's the arrangement that's been made, and yes, we would be happy to do that again. Again, the protocols are very strict around infection prevention and control.
Yeah, I just wanted to turn briefly to mask wearing.
Yes.
Sorry, we jumped on that a bit. But you're strongly recommending that people wear masks on public transports and aeroplanes, whatever we're going to call it. But as we've seen, there's already complacency, which has come in. You've got a few people using the QR code. Do you think that the authorities could have been clearer with their communications? We've had David Skeeve on radio today saying he thinks that messaging has been unclear and this is leading to complacency.
Actually, I think we've been very clear with our messaging throughout. I think it's been one of the strengths of our response, and right from when the country all shifted down to, well, initially everyone outside of Auckland and then Auckland as well to alert level 1. My message has been very consistent about continuing to use, and I should have used different language. I've said masks, it's face coverings, while using public transport and flights. I'm providing a really clear reminder to people now that that's still my strong advice, and please do so. That will help us enjoy our holiday safely over the long weekend.
What's stopping you from making that mandatory under level 1?
I'm not the decision maker on that, but what I can say is that the Minister has asked for advice on the pros and cons of doing that, so we're busy pulling that together.
Would you support the government launching an inquiry into the country's COVID-19 response so far to address remaining weaknesses?
Well, I want to echo the comment made by, well, actually, can I just pick up on your final comment there? I don't think an inquiry is designed to identify and respond proactively and in a timely fashion to weaknesses or areas for improvement. And so a fundamental part of our success in this country has been our ongoing review, learning and adapting. An inquiry is a different thing. It's a bigger, longer, more in-depth look at things, and I think the time will come for that. However, the inquiry that's been the inquiry that's been called for for example, in the journal article that was published yesterday, is that larger thing, and it's more designed to determine what is it we could learn in preparation for the next potential pandemic, rather than that nimble learning and adapting that we should do in the current situation. And while we're still, as you know, actively in the middle of dealing with this current pandemic, my feeling is that now is not the best time for that more intense inquiry, but the time will come. Please.
How is the investigation into the case A going, how they became infected from the first case?
Yeah, so our strongest suspicion here is that it was on this vessel, the Savrana Seville, which Case A spent time over 2 days working on in Auckland on the 12th and 13th of October, and likewise Case B was on that vessel on the 12th of October. That's why we're awaiting the testing from that ship, which is currently in Brisbane.
But are there any obvious holes of how they may have become infected?
That will be something to be looked at, obviously, and there's been a number of conversations with the individual. But he did spend and does spend in the course of his work quite a bit of time on there. So we will look at the end-to-end around use of PPE, length of time, proximity to other crew, and so on. Other precautions that possibly could add into the protections for anyone boarding a ship. Final questions?
The person that did go to the Green Hive pub, obviously you're only saying 2 new imported cases today, but have there been any weak positives or anyone that's doing further tests that would have been a contact of this confirmed case at the pub so far? Is there any further testing or anything you can tell us about further?
No further positive tests there from any of the close contacts, and of course that's why we're doing the testing today. I hope as many people as possible who were at the pub get tested today. The sooner we have the tests done, the sooner we'll have results, hopefully most of those tomorrow, and of course we'll report any positive cases and take appropriate action.
What about that wider suburb of Green Hive, someone that feels cautious or anxious because they went to the nearby supermarket, the Hobsonville Point or anything, where they may have been in contact with someone that went to the pub? What's your advice to them? What should they do as the whole suburb?
Well, the first point is if anyone is symptomatic, of course, and remembering we're 6 or 7 days down the track, then they should definitely get a test. If people are concerned that they may have been exposed, maybe a contact, or if they've spent time around someone who was in the pub that night, then yes, they should go and get a test. That pop-up is there and operating today. Final questions? If not, thank you very much. Appreciate your support. Thanks, Alan.